So, ladies, I recently went for a medical exam, and I also received notice in the mail for getting a mammogram. And what is so interesting is it appears that when you get older, there is a cutoff point as to when you become viable for medical examinations. It's like, you know what, you're too old, we don't care. And like the sun has set on you already. So we're not going to worry about whatever it is that you contract or get or anything. So I had a PAPS test, and the doctor said to me, good news is you don't have to do this after 70. The good news was she thought I was way younger than what I actually am. So that was the silver lining in that conversation. But she said to me, well, you'll never have to do this again after 70. And I said, oh, well, then that means like I'm pretty much like, because you get them done, I don't know, every 2 years here in Canada. And it's like, I said, well, I guess I'm done then. And I thought to myself that there was oh, thank God I don't ever have to do this again. And then I was like, okay, wait a minute, that's not very good. I want to keep having these because cancer just disappears from anybody's, array of being able to get it once you hit 70? Like, do you become immune to the disease at 70? And it's the same thing with my mammogram. My mammogram says you come in every year until you're 74. I don't know where that number came from, but until you're 74, and then you don't need to have them done anymore. And
Yeah.
I honestly feel that as we age, we have to become such an advocate for ourselves and for the testing that needs to be done to keep us viable, cancer-free, all of those things. But we literally have to fight for ourselves.
Now, I think the audience should understand we have two different demographics here. I live in the United States. You both live in Canada. So we have two different health systems here.
Yes.
In reference to just healthcare systems. But we have the same, our healthcare system is the exact same thing as you have. At the age of 70, a woman no longer is covered to get a pap smear test. I don't know about the mammograms. And the reason why I know this is I was having a conversation with somebody, excuse me, a good friend, and she is 60, she's 70. And she went in and they said, this is your last one. Or she is on the coverage of Medicare. When she turned 65, we have the Medicare system here. And they will no longer pay for it. And she walked out a little confused because she is a woman who still has all of her woman parts. That means she still has her ovaries, she still has her cervix, she still has her uterus. And those are very high in cancer. And so if she chooses to have them later, as the years progress, she has to pay for it out of her pocket.
I'm not sure in Canada if because we do have private healthcare clinics that are available to people who can afford them. I don't know if I went into my doctor's office at 71 and said, it's time for my next PAPS test, if they would say, no, we're not paying for it, or no, you can't have one. I don't know. Literally, I don't know what's going to happen.
Well, I just looked at why, and supposedly it's because the risk of developing cervical cancer is very low. So they've decided that 70, you're no longer as much at risk. So I didn't know we did it in degrees.
Yeah.
Are you still at risk? It just I know tests cost money and stuff like that, but still, like, dealing with someone that does have cancer is a lot more expensive. So
exactly,
it doesn't really
all the way up.
Sorry, I would find that interesting, Tracy, to see what would happen if you went in after the point.
And the
I
reason,
plan to, like, like
yeah,
it's like every 2 years, I'm gonna go back, and I might be denied, in which case I'll have to find a
mhm.
private clinic that will do that kind of stuff. But yeah, and it's the same thing with the mammograms. Like it says right on the sheet, you can do this until you're expected to come here every year until you're 74, and then we don't want to see you anymore, basically.
And I find that like so my doctor, I had to switch doctors, but I found a good doctor down in Florida who knows my whole cancer history and everything. And he had said that again, um, age of 70, you don't need it. He says, but he does not believe in that law, and he will continue to give the um, examinations because last year, 2 years ago, within a span of 6 weeks, he had 3 women in their mid 70s come in complaining of problems in that area, and all three had either ovarian or cervical cancer
Wow.
that probably could have been prevented if they had the exams.
But that's what we do is we react. We're not preventive. Why wouldn't you
Right,
continue it on till you're done? You're,
right.
you've passed on and just be preventive. I don't understand that.
Yeah.
Well, Tracy, you said it perfectly, Tracy E, when they said, "Oh, you don't have to come back anymore." You had that split second of,
Oh, thank God. I
"Oh,
hate
thank
these
God,"
things. You know? Yeah.
because it's not a comfortable exam. Let's
Yeah.
be real here. And so, you know what? I'm going to be really bold here. I wonder if they tell a man that when you hit a certain age, we're no longer going to give you that prostate exam.
You know what?
Like, I wonder.
I believe that they do, unless there
Ah,
is a prostate problem in the family, then
look at
it changes.
Tracy G's down
Yeah,
there
Tracy
looking.
Well,
G
I
said.
want to know
Yeah.
because it's like,
But okay, but what also really concerns me in this conversation is that while the government turns around and says we no longer think that you need to have these tests because your risk drops, which may be in fact a true
Mhm.
statement. But again, I think it should be up to the individual to make that decision as, for their own health purposes to say, yes, I'm going to continue getting exams, or no, I'm not. But it also leads to the fact that if you are older and you're in your 70s or you're in your 80s and something happens to you and you need treatment, what kind of treatment options are they going to actually offer you? Are they going to offer you the same thing that they would offer a 40-year-old or a 30-year-old? Or are they going to look at that and go, you know what, you're on the way out the door anyway. So like
Yeah,
here's what we're going to offer you. This is it.
right.
my top search said after 70 for prostate as well.
Yeah.
Okay.
So there's one
Wow.
too. And I believe it's exactly what you're saying, Tracy, is they're not gonna put money into us.
Yes,
Right? Because
we're no longer worth it.
yeah.
And I think that's baloney because women, especially, we've become so like we don't stop. Like, look at the three of us. We're not even thinking of retiring. We're not even thinking of different things. We might change what we do, but we're not going to sit back and do nothing.
No.
And and I know somebody who is 80 something years old fighting breast cancer, and the only way she found it is she felt a lump in her breast. Now, what would have happened if maybe she felt that sooner or had a mammogram?
Yeah.
Who
Yeah.
knows? And because she's 87, if you were to meet her and she had a conversation, like when I found her age, she has more freaking energy than I do. And she has a better social life than I do.
Well, there's that
So,
stereotype of when we
right,
get to a certain age, right? Like we just
right,
are sitting in our
Yeah.
chairs doing, rocking on the porch or something. I'm not really clear what
right.
exactly we're doing, but they don't take so
Nothing.
a lot of grandparents take care of their grandchildren for their kids, right? So
Right.
they're vibrant, they want to stay healthy and things like that. There's a lot that we still can contribute, whether it's jobs,
Yeah.
money, like
Wisdom,
babysitting, pardon me,
wisdom, wisdom,
wisdom.
wisdom.
And you really feel it as you age that you are discarded.
Yeah.
Yeah. Yeah.
Yeah. And I mean, I think the whole message here is that regardless of your age, you always have to make sure you advocate for yourself. Don't let somebody else say, well, this is it. And then you walk out of a doctor's office thinking, well, I have no other options. I've just been told I have no other options. It's like, you've
Right.
always got to, you know, seek out the help that you need when you have a health related problem, and the preventative stuff, like regardless of what your age is. And I mean, that will be us. I know the three of us will continue to do that. But it's just, it's such a shame that, you know, when you get that to a certain age, it's like you just might as well be put out to pasture because you're no longer viable to a community.
And
Right.
like we mentioned in a previous episode, Fit for Life and being functional fitness.
Yeah.
And so we're doing our part. We're
Right.
doing our part.
Yeah.
Can you not do your part and just allow us to
Exactly.
do some tests?
Mhm.
Yeah. Yeah. I think it's important, but who knows, maybe we'll be the start of change.
Yeah.
But
Yeah.
I feel bad for people who can't afford. So,
Yeah.
there is people on an income that cannot afford to pay for it out of their pocket. And that's shameful. That's just shameful that you're at a certain age and because of risk is low. And so again, statistics are statistics. They're a number. That's all they are. And we need to stop looking at people's lives by a number. Oh, they're 70. They're no longer, the chance of them getting that form of cancer is low. And they're going to, the expectation of life is this amount and just all these things. They're all numbers. That's all it is. And we're not a number. We're humans.
Yeah, you know what? Maybe some doctors who are older will start creating facilities where older
Yeah.
people can go and get the care and the respect and the level of treatment that is required. I mean,
Right.
that's, yeah.
Yep. So what do you think? Do you think there should be an age limit on healthcare? And what are your thoughts about it? Let us know in the comments. Share this episode with somebody that you think might need to hear this. Make sure you hit the like button, the notifications, so you know when our next episode is out, and the subscribe button. Until next time.
Thanks for watching, and we hope to see you as a regular member of our community.